Well, my name is Dr. David Lewis. I'm an otolaryngologist. For those who may not understand what that is, it's an ear, nose, and throat doctor. We basically are a branch of surgery. General surgery, way back in the olden days, was the only kind of surgery that there was, and everybody else began to do other things in general surgery, and eventually all of the surgical subspecialties were created. And otolaryngology, or ear, nose, and throat surgery, was actually originally eye, ear, nose, and throat surgery, and it's the oldest of the surgical subspecialties. Probably 50 or 60 years ago, eyes and ear, nose, and throat split, so that now there's the two different specialties, but that's what I am. I am from Utah originally. I grew up there. I went to the University of Utah to medical school and then did my ear, nose, and throat, head and neck surgery training in Louisville, Kentucky. After I finished my residency training in Louisville, Kentucky, I practiced for a short time in Sikeston, Missouri, and then came here to Jonesboro. My family and I have been here for over 20 years, and my wife and I have raised all of our children here in Jonesboro, and it's been a very, very good place for us. We've really enjoyed Jonesboro and love the people here. And it's been a great practice for us. I joined a practice that was originally two other physicians, and I was a third. And eventually we became OFSC, which is Otolaryngology and Facial Surgery Center. We basically are the dominant ear, nose, and throat, head and neck surgery practice in this corner of the state now. And justifiably so, we have created a practice that actually covers the entire scope of otolaryngology. There are very few things that otolaryngologists do that we don't do, and we, in addition to that, have done other things that make our practice unique and sort of a university type practice as opposed to a primary practice out in the rural area of Arkansas. St. Bernard's has helped us with that. We have enjoyed our association with them, and things have gone well for us while we've been here. For those who may not understand what otolaryngologists do, certainly there are some things that you have been able to associate with us, like we put tubes in kids' ears and we take out tonsils and adenoids, but we also do head and neck cancer surgery. We take off more skin cancers and do reconstructive surgery of the face than any other specialty. If people have difficulty breathing through their nose, we try to sort out exactly why they can't and try to fix that problem, and that includes both treatment with medicine and with surgery. Part of our training includes the treatment of allergy problems, and so we do a lot of allergy investigation and treatment. We treat ear things. Probably one of the reasons why I went into otolaryngology originally, back in the olden days when I was in medical school, is I went and saw an operation where they were repairing a hole in an eardrum, and I thought it was fascinating because it was done under a microscope, microsurgery, and I watched the head of the program at the University of Utah doing a tympanoplasty, and I thought to myself, gosh, that looks pretty interesting. I think I could do that. And actually I looked at him and I looked at how he was doing, and I thought, I think I could do that better than he can. And so that's the reason why I went into otolaryngology originally, but there are many, many other aspects of it that I like. If I had to say the most enjoyable thing that I do every single day, it would be dealing with small children. I like dealing with small children, but I don't think that I'd ever like to be a pediatrician, because pediatricians do all the hard parts of pediatrics, and I get to do pretty much the easy parts of pediatrics, and it's very enjoyable. But I've enjoyed my time here in Jonesboro, Arkansas, and certainly being an otolaryngologist.